Generally, there are two major types of family planning methods you can adopt: the natural family planning methods and the modern family planning methods. In my last video, I discussed on the natural family planning methods you can adopt. While on that, someone reached out to me after watching the video and he said, "I didn't hear you mention condom. Is it not part of the family planning methods?" And I replied, "Don't worry, in my next video, I am going to discuss the modern family planning methods, and that is where condom belongs. Today, in this video, I am going to talk about the 8 modern family planning methods you can adopt. In case you are not comfortable with those natural family planning methods discussed earlier, because most of them are not reliable, while others are also reliable. Likewise, the modern family planning method. So today, I am going to elaborately explain different modern family planning methods you can adopt. But before I go into that, let us do the usual. You're welcome back. If you're just meeting me for the first time, my name is Ife, and this is Ife Health View, where we talk about everything reproductive health. If you're a new subscriber, thank you for subscribing, and if you're an old subscriber, thank you for coming back. Like I said earlier, we are going to discuss the 8 modern family planning methods you can adopt, in case we are not comfortable with those natural family planning methods we discussed earlier. The first one is hormonal pill, or you call it contraceptive pill. This contraceptive pill is used by the woman, but before this method is adopted by the woman, a doctor must be consulted to recommend the particular pill that is suitable for your body. A pill is taken every day for 21 days, and no pill is taken for the remaining 7 days, so as to allow menstruation to occur. This pill prevents the release of egg from the ovary, that is ovulation. It is a reliable method, but it is safer if the man uses Spermicidal cream in addition. The next one is the use of injectable hormone drugs, or the use of injection. During this method, an injection is given to the woman every 3 months or every 6 months interval. This injection contains a hormone called progesterone, which prevents ovulation from occurring, and this is a sure way of preventing pregnancy. But it is advisable to consult a qualified medical personnel to give you this injection to avoid complications, because it has side effects, but it is very reliable. The next modern family planning method you can adopt is called Norplant. This drug is implanted subdermally, that is under the skin, into the arm of the woman to prevent pregnancy. It lasts for about 5 years, but can be removed anytime pregnancy is required. The fourth modern family planning method you can adopt is the use of barriers, such as sheath or condom. Condom is a thin sheet of rubber. There are male and female condom. The male condom is worn by the male. A man fits the condom over an erected penis before sexual intercourse is performed, so that the ejaculated sperms are collected into the condom. No one condom should be used twice to avoid breakage that could lead to the release of sperms into the body of the woman. And this method is not reliable, because most times this condom may break and some sperms may escape into the body of the woman without the knowledge of the man or the woman, and this can cause unwanted pregnancy. So it is advisable to use Spermicidal cream by the man in addition to support the condom. The fifth modern family planning method you can adopt is called Diaphragm. This is a rounded sheet of rubber, and it is inserted into the vagina of the woman before sexual intercourse to prevent sperm from reaching the oviduct. And this is removed 8 hours after sex. But it is not very reliable, because most times sperm may have escaped into the vagina and cause unwanted pregnancy. So it is advisable to use it alongside with Spermicidal cream. IUD, Intra-Uterine Device, is another modern family planning method you can adopt. IUD is a small coiled piece of metal or plastic which is inserted into the uterus of the woman. It lasts for about 12 years, 10 to 12 years, if your body doesn't reject it. It is inserted by a doctor or any other qualified medical personnel, like the midwife, the nurses, and IUD stops fertilization of the ovum, and also prevent implantation of the zygotes in the uterus. So this helps to prevent pregnancy a lot. It is very reliable, but it must be checked on. You must go for checkup at the interval of 3 to 4 months to ensure that it is still in a proper position, because if there is a shift in a position, pregnancy may occur. So that is why it is advisable to always go for your checkup if you are using IUD. It is a very reliable method of preventing pregnancy. Another modern family planning method you can adopt is the use of spermicidal cream or foaming tablets. This cream or foaming tablet is used by the woman before having sexual intercourse. The woman applies this cream deep inside her vagina before intercourse. The cream kills sperm and thereby preventing sperm from reaching the egg. It is a method of family planning you can adopt, but it is not very reliable because most times not all sperms are killed and unwanted pregnancy can occur. That is why it is advisable to use it alongside with condom or diaphragm. The last modern family planning method you can adopt is called sterilization. There are two types of sterilization. Sterilization in male, which is called vasectomy, and sterilization in female, which is called tubal ligation. This operational method involves the cutting of the sperm ducts from the man to prevent sperms from being released from the testes. Or in the case of women, it involves the tying or the cutting of the oviduct, that is the fallopian tube, in order to prevent the eggs from being released from the ovaries. These methods are very reliable. It helps you to prevent pregnancy for as long as you want. Summary: the 8 modern family planning methods you can adopt are contraceptive pills, injectable hormone, Norplant, the use of condom or any other barrier such as diaphragm, sheath, sterilization, which involve vasectomy in men and tubal ligation in female. We have the use of spermicidal cream, and finally IUD or Intra-Uterine Device. Any one of them is good, but you have to seek the advice of a medical personnel to know the one that is suitable for your body. Some of them are reliable while others are not reliable, and some of them have side effects. So you have to be very careful when applying them.